You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Greg Keller. Dr. Keller is internationally recognized by his peers as a master for his unique and innovative contributions to facial plastic surgery. Dr. Keller is a Castle Connolly rated top doctor, an honor bestowed on only a few physicians nationwide by peer selection. This year, he was selected by Strathmore's Who's Who as the #1 top professional in facial plastic surgery in the country. His contributions include 2 textbooks and over 25 medical peer-reviewed articles in facial aesthetic surgery and laser technologies. As a single contribution, Dr. Keller is the inventor of endoscopic facial plastic surgery and holds 3 patents for these techniques. Dr. Keller is honored to hold the title of Director of Facial Plastic Surgery at the Fellowship at UCLA. He has discussed his techniques and innovations on Good Morning America, Discovery Health, KBC, Extra, and E, and many others. His patients include many well-known actors and actresses, studio heads, corporate executives, billionaires, inventors, authors, and other personalities. His patients come from India, England, Canada, Korea, France, and all over the world. We've invited Dr. Keller on the program today to discuss new mini facelifting techniques. Dr. Keller, welcome to the program.
Thanks for having me, Randy.
Really impressive. You know, you've been in Santa Barbara for quite some time. They know you in LA as the go-to guy for a natural-looking facelift. And so I wanted to, we've had you on the show before, to give you the intro you deserved, because a lot of people don't know, you know, and when I did the research, you know, I forgot about all these little things, you know, who's who. Tell me about that, by the way, and the top-rated doctor in the country. Why does that happen?
I have no idea. Basically, your peers have to nominate
other doctors.
Other doctors in your field nominate you for that, and eventually something happens or it doesn't, and they write you a letter, and that's about it.
Okay, all right. Yeah. Now, facelifting. A lot has changed, I guess, over the last 20 years.
Well, a lot.
Or the mini lifts, I guess, are coming into play.
Well, yeah, they're coming back is what's happened. Basically, they've always been around, and what we've discovered is basically there are a lot of needs as far as facelifting or facial rejuvenation goes. Different people need different things, and mini lifts fit the needs of people who have to get things done quickly, don't have a lot of downtime, and yet want a good job that really refreshes them and makes them look better.
Now, you invented the master facelift, or master lift facelift. Tell me, is that what we're talking about here? Is that a different kind of a facelift, or is that a mini lift?
Well, what we're trying to do is, you know, differentiate. The master lift is for somebody who has little time to recovery, who wants absolutely the best, or has problems that are difficult to treat.
Okay.
Or somebody who isn't quite happy with their facelift and wants to tune that up a little bit, or wants to tune up an older facelift. These can be more difficult type of processes, and you know, technology is developed so that we can handle the big turkey gobbler bands, the granny be gone type of bands,
okay,
all of those types of things that have given us problems in the past. Nowadays, what people are looking for, or many people are looking for, is a quick type of facelift that tunes them up, gets them back within a week, and really fits their lifestyle well.
Now, these quick mini lifts, I could talk, you know, I talk to some guys, they say, well, this is gimmicky. Can't get the results. What is your response to
well,
that?
In a way, that's true. You can't get the results that you get when you have a lot more downtime. But what we've done is we've tried to combine those mini lifts to extend them a little bit with new technologies.
Okay. Now, you probably do more of these than most doctors nationwide.
Well, we do probably, I think the average plastic surgeon does about 23 facelifts a year. We're somewhere between 120 to 200 per year, so we have a lot of experience.
So you do more than a month than some guys do in a year.
I guess so. We specialize in that, though, so that's what we attract into our practice.
Okay, UCLA, you know, I touched on that, but you're head of their facial plastic program. Is that right?
Well, the Facial Plastic Surgery Fellowship program.
Okay, okay.
Yes.
And what is that?
Well, basically, we train other doctors in advanced techniques, and most of those go on to be teachers at other universities, at Cleveland Clinic, at University of Texas Southwestern, George Washington, other places in New York. And this seeds sort of the population with what we do at UCLA.
Okay. Now, you know, and I said at the top of the show, I've interviewed plastic surgeons, facial plastic surgeons nationwide. And wherever I go, I mention your name. And they go, that guy has a big name in the industry. I guess because you invented I mean, is that really how you got your popularity, or you speak at these conferences?
I don't know. I've done a lot over the years. I've spoken at a lot, and you know, I like my peers. You know, they're all competent people, and you know, it's nice to be a part of a bigger thing.
You know, the other thing, and I said I don't want to endorse, and for people that know the show, I don't endorse the doctors. I just ask the questions. I said you have my full endorsement. I've been looking at before and afters now since the year 2000 of doctors. And you know this, and I'm careful because I have other friends that are plastic surgeons, Newport Beach, Beverly Hills, and people will ask me who I should recommend. And I said, well, for the most natural look, Dr. Greg Keller. Because you do. I mean, you give a natural look. So what I wanted to do when we invited you on the show, because we've had you on many times, so I wanted it to be a little bit different because I want, if somehow we could figure out a way to kind of let the public know what they need to know if they're considering a facelift or a mini lift, because I guess there's a lot of different names for these mini lifts now.
Well, a lot of this is the art and the practice.
Okay.
And you know, what we've tried to do is take a look at our patients and their patients' needs and put everything on a continuum. Some people are globalists. They have to redo the whole face before they feel comfortable with the result. Surgeons are that way, patients are that way. And for those, we talk about the master lift. That's a redo of a rejuvenation of your whole face in a natural manner. We rejuvenate the mid-face, the neck, the chin, the forehead.
Is that for the older patient?
It can be, or it can be for the younger, depending on what
the needs are. You call it a redo.
Are.
What do you mean by that?
Well, I mean a rejuvenation.
Rejuvenation.
Of the face.
Okay.
Yeah, we're putting people back to the way that they were, and that's the fundamental concept of that. That can take about 2 weeks to recuperate from, and you'll be out right away. I mean, pain isn't a horribly significant thing. It's about a 2 out of 10, no matter what kind of facial plastic surgery you get. And then there's the person who has a very active lifestyle, who wants to get something done, maybe doesn't have a lot to do, or maybe does, who wants to look better, refreshed,
okay,
and get a nice, excellent result. Some of those have been underdoing it, you know, the current mini lifting type of things. So you have to do a little more to them to get a satisfactory rejuvenation of their face and get them out right away. And this is what they want. And we can do that at a reasonable cost. You know, it can be very reasonable.
But what names do they go by? I mean, I hear things like S-lift or weekend lift.
S-lift, Swift lift, lifestyle lift, all of these things.
Are they all about the same thing?
Everybody does things a little bit different, you know, and you have to look at it and make your choice. But what we do is we extend those a little bit. And we're able to do that without increasing recuperation by using an ultrasonic scalpel, a laser liposuction technique, and that prevents a lot of the bruising and swelling that you get otherwise.
Okay. Let's talk about the mini lift for a moment. And I'd like you to get a little technical. Let's talk about your technique, since physicians from all over the country come to learn from you. Let's talk a little bit about what you're doing, where you're hiding the incisions, which areas of the face are you lifting, are you pulling, are you repositioning? And let's start there. What you're addressing.
What we call it is the facelift rapide, just because we ran out of names for it, essentially. Okay. And what we do is we make, usually an S-shaped incision that comes along the sideburn and just in back of the ear. And what we're trying to do is come out a little bit of the way to grab things that we can lift.
Are you grabbing the fat, the muscle, the skin, all of the above?
Well, we grab the muscle.
Okay.
And we pull that up. And what we want is anything that we put in there to dissolve and yet maintain its effectiveness. Okay. So we have to lift the muscle in such a way that the body heals that in shape. If we leave sutures, loop sutures or something like that in there, they can extrude, they can get infected. So we want to take things and put them in so that your body will do the work for us. And this is specially programmed to lift the muscle, the cheek fat pad. We have specially designed sutures that lift the cheek fat pad and hold them up. We can pick up the neck.
What about direction of pull?
Well, direction of pull is very important.
Are you pulling up, back? What are you doing?
All of the above. And,
okay.
And you really have to do that. If you pull in one direction, people say, well, I pull vertically, but you can get lines that form creases and things like that if you do only that. And it depends on what area and what depth that you work in to do that. So what we want to do is pull in several different directions that put things back naturally where they fall. For instance, the cheek fat pad falls downward, but it also rotates in toward the nose. So we want to correct that in more of a diagonal yet more vertical direction. The muscle here falls downward, and yet we have a fat pad and a line here that comes backwards. So you want to pull those things in both of those directions by dividing where you suture and what you do. And you can do this with a mini lift or a more intense type of lifting process.